Here we're going to be considering CBT's modest aim, and that's the idea of helping provide better coping strategies. Now, we touched on this point in an earlier video, so I'm only going to briefly discuss it here. But the outcomes of CBT are heavily focused on helping you to cope with your issue rather than to resolve your issue. Let's take the example of a past traumatic experience, for example. So, the likely aims and successful outcome for you in this situation is based on you being able to cope with it more effectively. This could take the form of you having a deep understanding of how you feel about what happened, what impact it had on your thoughts and perceptions, how you adapted to it, and your role in it. If you were to be in a position where you can notice when external events or people trigger associations with the painful event, which cause your thinking to become irrational, as well as those unpleasant sensations to occur in your body, but you're able to notice the thoughts, challenge them, and help yourself settle before making a reactive comment or response, you've achieved the ultimate CBT aim. This is what shows me that the model is incomplete or insufficient, because why don't we want to have a neutral response? Why isn't the objective for that experience to be classified in terms of your memory as another event? Sure, it was, if you were to inspect it, you might appreciate and acknowledge it was painful for you at the time, but you can now see it objectively and it doesn't activate a stress response. In other words, why isn't the objective to neutralize the perception of the event? Why do we aim for coping? And this for me highlights that the model lacks the technical understanding of the underlying processes that cause the symptoms in the first place, and therefore it leads us to giving it what's known as our best guess. Now, the real point that I want to highlight here is CBT the real gold standard, or is it the most convenient gold standard? Because to a significant extent, cognitive behavioral therapy was widely adopted and promoted as a primary psychological intervention, in part due to its structured nature, which makes it relatively inexpensive, it's very easy to standardize, and it's very scalable. And CBT's clearly defined protocols, its manualized approach, its brief time-limited format, all collectively allows it to be systematically taught, delivered consistently, and assessed objectively. And additionally, its heavy reliance on self-directed homework and structured interventions made it adaptable for delivery via less costly means such as guided self-help, group settings, or even digital platforms and AI. As a result, CBT became especially attractive to healthcare systems, insurers, policymakers, who are all looking to find cost-effective, evidence-based treatments capable of reaching large populations. However, this economic efficiency and scalability, while undoubtedly beneficial, does also open the idea to question whether CBT was selected over other therapeutic modalities, not because CBT is superior in terms of its effectiveness, but because it's practical, affordable, and it can be disseminated really easily. And Clark in 2011, in describing the implementation of NICE guidelines for the psychological treatment of depression and anxiety disorders, actually explicitly states that one reason CBT was prioritized was because it was practical to scale and it met health and economic needs. So now we've seen a list of reasons why maybe CBT is undoubtedly effective in terms of its delivery, its time-sensitive nature, its repeatability, its scalability. But do you want the best treatment, or do you want the best modalities, or do you want the most convenient? And that's something for you to just consider.